This is Dr. Mike DeBord. We're in the B3 studio doing another educational video. This time we're with Dr. Jim Stray-Gunderson. We're going to talk about the science and research of blood flow restriction training. Dr. Jim has been an Olympic training advisor since 1984. He's a world expert on BFR training, and he developed these B3 bands, so he's probably the smartest guy I know, that's for sure, when it comes to exercise and BFR, and we're very fortunate to have him on our scientific advisory board. You know, most of us are aware of the current belief in exercise. We were taught this way: no pain, no gain. The more you hurt, the better it is. We're taught to do high intensity exercise, whether it's heavy weights or long exercise classes or running long distances, which can tear or damage muscle, but we're led to believe that there'll be a recovery period. We'll be sore, and then the muscle will rebuild bigger and stronger. Well, there's a better way. As you've probably heard with B3 Sciences, we can work in half the time with half the weight or work and get better results. Imagine being able to work out not in an hour, but in just 20 minutes, being able to do lightweight exercises, not heavy weights, to not have soreness the next day or very little soreness, to recover to where the next day you could even exercise again, and at the same time get better results. And it's all possible with the B3 bands. Just add them to your favorite exercise. Today, Dr. Jim's going to briefly review the research and science that's out there. We've got 6 studies on the website that you can review, or you can just take it from Dr. Jim right here. He's going to talk about how BFR exercise with the bands increases growth hormone release, how it does less muscle damage, which leads to shorter recovery, how it will increase strength as compared to traditional exercise, how youth and teenagers can improve more by using B3 bands, how senior citizens and the elderly can improve function by doing simple exercises like walking. He's going to talk to you about a big study on over 12,000 people that shows BFR is extremely safe, and there's even additional benefits of increased in bone density and cardiovascular benefits when you do BFR exercise. So I'm going to bring Dr. Jim in. He's going to start by telling you what happens in your body when you do BFR exercise.
Hi, Dr. Mike. Pleasure to be here today. One of the first things to say is that we can briefly discuss what the mechanism is. This is what this particular paper was concerned about, and the idea that when we restrict blood to working muscle, it's not getting the blood supply that it needs to continue to sustain that activity. And because of that, a metabolic crisis or a disturbance of homeostasis is induced in that muscle, and that disturbance of homeostasis is communicated to the brain via afferent nerve pathways. If that signal is strong enough, the brain reacts by secreting growth hormone from the pituitary gland, and as well as increasing heart rate and ventilation and sweating out of proportion to the exercise load itself. And one of the things that happens with that is, let's say you have growth hormone coming out of the pituitary gland. It has many functions in the body. Some of those include going to the liver and making IGF-1, which is insulin growth factor 1, which is a very anabolic substance. Another one is going directly to muscle and binding to cell surface receptors on the muscle, amplifying and stimulating protein synthesis. Another really nice effect of growth hormone is it goes to the fat cells, and it's called lipolytic, meaning that it breaks down fat and in preparation for using that for energy. And over time, doing this produces a loss in fat stores. Suffice it to say that there's a very robust release of growth hormone from the pituitary with blood flow restriction training.
So what this means is people that are used to high intensity training that are already getting growth hormone release, you can reduce the amount of work and weight dramatically, which is easier on your body. For us, people that maybe don't do high intensity exercise, maybe we just do light exercise. Now we're going to start getting growth hormone release, which will have all kinds of benefits as compared to not getting growth hormone release. Let's talk about the next study, Dr. Jim.
So one of the things that has been looked at is the idea of this balance between blood flow restriction training and traditional weight training. And the main finding here is that with proper maximal standard weightlifting, you can get a certain amount of improvement and in strength and fitness, but you can also get the same amount of that improvement with blood flow restriction training. And as an added benefit, because the absolute loads are low and it takes you a short period of time to perform the training session, there's less muscle damage done. And because of that, there's also faster recovery. So BFR exercise should be favored when applying high-frequency training regimes for muscle hypertrophy.
This one's on strength improvement, Dr. Jim, and I've noticed this just using light dumbbells. I use 3 to 5 pound dumbbells, and my strength has gone up dramatically. What's going on there?
Well, the idea is that we're able to use these light weights with blood flow restriction in place to create this metabolic crisis. And one of the things that is very important for standard heavy weightlifting is to recruit as many of the motor units in a muscle as possible. But when you're doing very light weights, you're only recruiting a few motor units and the easiest contracted ones. But the idea that we get these motor units into metabolic trouble allows us to then have to recruit other more and faster motor units to just do the work. And so at the end of these protocols that we have, we've recruited all the same motor units that you have with standard heavy lifting. But again, it's been light weights alone without blood flow. One of the things to say is that if we just did the light weights alone, we really wouldn't be able to improve any of these strength training. So it's this combination of blood flow resistance, restriction, plus light weights that produces the same benefit that you get from heavy standard lifting programs.
And that's great for all of us that want to stay strong. Doing light weights and getting stronger, staying strong. What a wonderful benefit. How about kids and teenagers, Jim, doing traditional exercise?
There is a very interesting study where the investigators added just doing light back squats with just the bar and blood flow restriction bands versus the standard more heavy traditional heavy lifting techniques. And what they found is that the light bars and the blood flow restriction actually did as well, if not better, than the standard heavy lifting, and both of them did much better than just the light weights by themselves.
So parents watching this, your kids can do traditional lifting exercises with light weight, which is necessary to protect the growth plates, but now they can get significant improvements in strength, which you just could not get before. Okay, Jim, Dr. Jim, is this safe?
Yes. In a word, blood flow restriction training is safe if done properly. And to that end, there was a study that came out in 2005 where they surveyed over 12,000 adults who had used blood flow restriction training. Some of them were hospitalized at the time, and some of them were healthy. And what we found is that there was a range of complications that were found to be associated with this, but a very, very low incidence. So, for example, there were 6 venous thromboses in the 12,000 people. But this is actually a much lower incidence, 1 in 2,000, than you would expect in the hospital populations, where it's more like 1 in 100. So actually a lower incidence than normal. And there are a couple other serious complications, but very, very few compared to what happens in the normal population.
How about the senior citizens in the country here, Dr. Jim, that like to just go for a walk, a simple exercise? How can they benefit?
Well, one of the things that's been studied and well studied is whether or not seniors can benefit from blood flow restriction walking exercise. And this particular study shows that there's a very good improvement from just going for a 15-minute walk with your blood flow resistance bands in place. And this ends up being a very time efficient and doable form of exercise for pretty much everybody, including seniors.
And what we're going to talk about here on the next couple slides is going to be very important to seniors. You know, the way I like to explain is, you know, if you go for a walk, it's good light exercise, but it certainly is not going to stimulate growth hormone. But if you take a person in their middle ages or senior citizens and you start stimulating growth hormone, you're going to get some changes that just have never been seen before. And we're going to talk about a couple of those, like increases in bone density. Dr. Jim?
Yeah, this particular study looked at doing leg presses with blood flow restriction bands in place, and they found that it improved one repetition max, or their maximal lifting capability, by 7.5% with the blood flow restriction technique, where there was only a 1.3%. So approximately a 5 times benefit from the blood flow restriction. And also approximately 5 to 6 times increase in cross-sectional area of the thigh was seen with this. But very interestingly, bone-specific alkaline phosphatase, which is an enzyme that is associated with bone turnover and bone growth, showed almost a tenfold increase in value from this blood flow resistance training.
And I know, Dr. Jim, you showed me a couple other studies that you're aware of some senior citizens that went from losing bone density over a few years to actually changing that and gaining bone density. Can you just quickly talk about that?
It's quite remarkable. We had a couple in our clinic, 68 and 69 years old, and they were in the habit of getting a bone density measurement with what's called a DEXA scan every 2 or 3 years for the last decade. And as we see with most of these populations, their bone mass or their bone density was gradually going down with increasing age. And then just after the second to last DEXA scan they had, just after the second to last DEXA scan they had, the bone density was a certain value, and then after a period of 8 months actually of blood flow restriction training, they had another DEXA scan, and in this case they didn't have a decrease in their bone density. They actually had a substantial increase. And so the idea that blood flow restriction training turned around this never-ending decline in bone mineral density with age.
Wow. And so anybody watching this, anybody who has somebody they care about, a parent, a grandparent, get them using these bands and just going for a walk every day. You're going to do wonders for their bone. But hey, how about cardiovascular benefits? Because everybody, especially our seniors, are concerned about cardiovascular. Dr. Jim, what would happen if they start wearing the bands and maybe going for a walk?
Yeah, this is a very exciting study. Basically, what we see here on this slide is a graph that shows mRNA, which is the messenger RNA. It is created when protein synthesis is upregulated in cells. And on the x-axis, what we see are a series of compounds that are associated with making new endothelium. And what all that means is that basically blood flow resistance training is making more and better blood vessels. And this is really exciting. This can help people with cardiovascular disease, diabetes, stroke, and really is a form of anti-aging medicine.
Awesome. Thanks, Dr. Jim. Well, you know, you saw some profound science, and there's over 300 studies, but I think there's something here for everyone. You know, for kids to be able to now work out and get strength improvements and even put on muscle size without any stress on their body, that's new technology. That's never been done before. Teenagers and adults being able to work out quicker, work out easier, preserve their bodies, get better results. Athletes at all levels. We don't have time to talk about all the athletes that are using BFR, and we just saw some profound evidence and scientific research why all seniors should be putting the bands on and doing light exercise. We also didn't get into injured and post-surgical, the results there, and even people with disease processes. But just about everyone can benefit from BFR training with the B3 bands. Well, again, this really changes everything. I want to thank you for watching this video. If you want to learn more about those scientific studies, go back to the website there and you can click on and read them. And again, half the time, half the weight, better results. Thanks for tuning in.